Okay, temporomandibular joint. Okay, definition is defined as the union between two articulation surfaces with the condyle, which is part of the mandible below, and glenoid fossa of the temporal bone above. It is known as the synovial craniomandibular joint. Okay, definition is defined as the union between two articulation surfaces with the condyle, which is part of the mandible below, and glenoid fossa of the temporal bone above. It is known as synovial craniomandibular joint. Components, bony components, condyle, glenoid fossa, and articular tissue. Okay, condyle. Okay, it is resembles a stage shown perched on a pillar. Okay, it varies size in different individuals. Okay, it is 16 to 20 nanometer in length and 18 width. Okay, it is made of a cancellous bone covered in thin shallow compact bone. Okay, condyle, that is resemble a dead stone perched on a pillar. Okay, it varies in size in different individuals. It is 16 to 20 in length. Okay, 18 to 20 mm. Okay, it is made of a cancellous bones covered by thin shallow compact. Glenoid fossa. Glenoid fossa is limited medially by the sphenoid and laterally by the root of the zygomatic process of the temporal bone. Okay, glenoid fossa is limited medially by the sphenoid, again lateral by the root of the zygomatic process of the temporal bone. The glenoid fossa is limited posteriorly by scomotympanic fissure and pterygotympanic fissure. Okay, the glenoid fossa is united scomotympanic pterygotympanic fissure. Anteriorly, fossa is bounded by a ridge of the bone described as articular eminence. It is bounded by a ridge of the bone described as articular eminence. The glenoid fossa is limited medially by the sphenoid, lateral by the root of the zygomatic process of the temporal bone. The glenoid fossa is posterior by the scomotympanic fossa and pterygotympanic fissure. The fossa is bounded by a ridge of the bone described as articular eminence. Articular middle. Made of a cancellous bone covered by thin layer of component. Articular cancellous bones covered by thin layer of component. Soft tissue component. Articular disc. Articular disc. Okay. And articular capsule. Articular disc. Articular capsule. Articular disc is also referred to as the meniscus. Meniscus. The articular disc is the sagittal section of appears in the band in shape, anteriorly attached to the capsule of the temporomandibular joint. Posterior aspects of the capsule and medially and laterally to the nerve. It is a fibrous structure divided joint into superior joint cavity, inferior joint cavity, soft tissue component, anterior disc. This is also revealed as the meniscus. The articular disc is in the sagittal section appear biconcave in shape, anteriorly attached to the capsule of the temporomandibular joint, posterior attached to the posterior aspect of the capsule, medial lateral to the nerve. It is a fibrous structure divided into superior joint and inferior joint cavity. Okay, temporomandibular joint. Articular disc. Okay, articular space, articular zone. So this is polypolar zone. Okay, this is submental articular zone. Capsular cartilage. This is fibro cartilage. Okay, functions of articular disc. Okay, it acts as a third bone, wherein various movements are brought about in temporomandibular joint. In the superior aspect, the translative movement occur, and in the inferior aspect, rotatory movement occur. Okay, first articular index is a third bone, wherein in various movements are brought about mandibular joint. In the superior aspect, the translative movement occur, and in the inferior aspect, rotatory movement occur. It acts as shock absorber. Okay, articular fibrous covering in the fibrous layer covering the condyle gland of articular eminence. The fibers are known are uniform thickness and outer superficial in a deep layer. Okay? It has a shock absorber. Articular fibers covering in a fibrous layer covering the condyle and articular eminence. The fibers are uniform thickness and outer super deep layer. Histology: the articular disc is young individuals are made up of fibroblasts interspersed by few collagen fibers. Okay, as person often these are made up of hyaline cartilage. Histology: the articular disc is young individuals made up of fibroblasts interspersed by few collagen fibers. Often there are made up of hyaline cartilage. Histology: the superficial layer parallel bundles of fibroblasts and few mature collagen fibers. There are fibroblasts in areas of cartilage. So the superficial layer is made up of parallel bundles of fibroblasts, mature collagen fibers. Deep layer cartilage, articular capsule. It is described as the fibrous non-elastic membrane surrounded by the joint, attached above the scomotympanic field. Posteriorly and margin of glenoid fossa, lateral to the orbital and eminence, anterior to the neck of the mandible. Above the disc, the capsule is fairly loose, whereas it is highly attached to the condyle. The laterally adjacent to form fan-shaped ligament, temporomandibular ligament, having an outer oblique portion and inner horizontal portion. Okay, capsule is lined on the inner aspect was innervilla membrane. Cellular membrane is made up of two layers: cellular intima and vascular subintima. Okay, as the articular capsule, it is described as fibrous non-elastic membrane. Okay, surrounding the joint, attached above the scomotympanic. Okay, till posteriorly margin of the glenoid fossa. Okay, lateral to the orbital eminence. Okay, anterior to the neck of the mandible. Above the disc, the capsule is fairly loose. Okay, whereas it is highly attached to the condyle. Okay. The lateral aspect of the capsule is thickened to form the fan-shaped ligament known as temporomandibular ligament, having outer oblique portion and inner horizontal portion. Capsule of the inner aspect of synovial membrane. The synovial membrane are made of two layers: cellular intima, vascular subintima. The cellular intima are the are cellular intima. Okay, cellular intima are 1 to 4 layers of discontinuous synovial cells. Cells are connected by cellular junctions. Again, do not rest on the basal lamina. Cell types include type A macrophage, like our Golgi lysosomes, and or light cells. Type B fibroblasts, like okay. A plus B, okay. Type A exhibits phagocytosis. Type B synthesis. Fibrosis is found in the synovial fluid. Okay. Cellular intima, 1 to 4 layers of discontinuous synovial cells. Cells are connected by cells function and do not rest on the basal lamina. Okay. Type A macrophage, like okay. Type A fibroblasts, like any plus B. Type A cells exhibits phagocytosis. This is myelin is found in synovial vascular subintimacy. It is a loose connectivation made of vascular elements along with fibroblasts, macrophage, mast cells, fat cells, okay, elastic fibers which prevent folding of membrane. Vascular subunit it is a loose connectivation made of vascular elements in fibroblasts, macrophage, mast cells, fat cells, elastic fibers which prevent folding of membrane. Synovial fluid is characterized by the physical properties of viscosity, elasticity, and plasticity. Okay, it is characterized by the physical properties of viscosity, elasticity, plasticity. Composition is a straw colored fluid secreted by synovial membrane. It is considered to be dialysate of plasma in small population of like monocyte, lymphocytes, free synovial and longitudinal neutrophils. Okay? It is straw colored fluid secreted by synovial membrane. It is considered to be diastole of plasma in small population of lymphocytes, free synovial neutrophil function. It provides a liquid environment for joint surfaces. Okay? It is released efficiency by lubrication the joint surface due to its viscous plastic nature. Okay? It provides nutrition to the avascular dysfunction. It provides a liquid environment for joint surfaces. Okay? It releases efficiency in the joint surfaces due to its viscous and plastic nature. It provides nutrition to the avascular disc. Blood supply to blood is supplied by superficial and ascending pharyngeal branch of the maxillary artery. Internal branch of the common carotid artery. Maxillary artery and superficial umbrella. Yes. Okay, now the temporal now. And mesenteric now. Okay. Different types of nerve endings supply the temperamental function. Function for this include type 1, type 2, type 3, type 4. Okay, type 1 Ruffin corpuscles, Pacina curve, Ruffin corpuscles, Golgi endings, Golgi endings, nerve endings. Okay, different types of nerve endings supply the temporal joint as well as the function of proprioception. Okay, this include type 1 Ruffin corpuscles, okay, melanoid in nature and perforation, the function of proprioception. Next, Pacina corpuscles, melanoid in nature, okay, and from the function of dynamo mechanic receptor. Okay, type 3 Golgi tendon complex, myelinated in nature. Okay, Golgi tendon complex, Golgi tendon myelinated in nature. Now static mechanical. For non-myelinated, they are most important to perform. Okay, type 2 are found in the articular. Particular type 3 is found in all parts of temperament. The articular all parts of the articular tissue. Type 4 fibers are found in articular capsule and posterior aspects of the articular tissue. Okay, pilafrin region. Okay, type 4 are found in type 4 fibers found in the articular capsule. Then posterior aspects of the articular tissue. Pilafrin region. Okay, joint displacement. This location of temporomandibular joint, the anterior direction due to force operating and if the joint and is open too wide. Okay, joint displacement. Dislocation of the temporomandibular joint, the anterior direction due to force opening and if the joint is too open too wide. Okay, trauma to the temporomandibular joint, fracture to the thin articular or fossa can lead to the trauma to the brain covered by severe blow to temporomandibular. Surgical fracture to the thin articular fossa can lead to trauma to the brain caused by severe blow to temporomandibular. The myofascial dysfunction MPT syndrome. It is a psychophysiological disease that primarily involves muscles of mastication, characterized by dull acting, radiating pain and mandibular dysfunction that generally involves limitations of opening. Myocardial bone dysfunction MPT syndrome. It is a psychophysiological disease that primarily involves muscles of mastication characterized by dull acting, radiating pain and mandibular dysfunction that is generally involves limitations of opening. Okay, clinical trisomy of the temporomandibular joint where the muscles of there are over contracted because of the accidents, over clenching of cranials. The ligaments holding the disc can be damaged. The result is slipping of the disc from its usual position. Clinical trisomy of the temporomandibular joint where the muscles of the temporomandibular joint are over contracted. Okay, because of the accidents. And these ligaments holding the disc can be damaged. Damage because the disc from its usual position. Okay.